Right, right. But as you said, Del, it is good, and it's a good development. At least it's in the right direction that we, remove the aluminum. And, even with dogs, there's with rabies vaccine, there are now thimerosal mercury-free vaccines that, again, are helpful.
Yeah.
But I want to, again, remind people that there are other components in the vaccines that really shouldn't be in there, and they cause problems as well.
There's a lot of, when we talk about, and my wheelhouse is obviously, human vaccines, but this one size fits all idea is really problematic. I mean, whether you have a preemie baby or, like my little brother, I think was 10.5 pounds when he was born, big chunker.
Right.
They're getting the same vaccine dose. And then I think about the amount of vaccines. People will say, well, I got my vaccines. And I was like, yeah, if you were born before 1986, you had maybe, 10 vaccines, really 3 shots given a couple times.
Right.
Your kids are now getting 72 vaccines. Is there a similar thing to the amount of vaccines you're saying over and over we're giving in the first several months? Do you feel it's overkill? I mean, is there...
Absolutely. And now there's more increased use of other vaccines like kennel cough, and influenza vaccine was developed. And
they have a flu shot for
They have a flu
animals?
shot for animals now. And most of the boarding and kennel facilities actually are now requiring that for animals to be boarded, or for doggy daycare. So there's definitely been an increase in the number of vaccines. And then you have what are called other non-core vaccines like leptospirosis and Lyme disease. And these other vaccines in most animals are not necessary, and they're not safe. They're very often not effective. And you brought up another good point about the one size fits all. A lot of my colleagues are vaccinating every animal in the same way, just like you said with kids. They're vaccinating large breed dogs like Labradors and sporting dogs, the same that they would a little Yorkie that may not even go outside very much, giving them the same vaccines and the same amounts. And, most of my colleagues are still giving the standard 1 cc dose of a vaccine. And fortunately, one of my colleagues, Dr. Gene Dodd, several years ago, published a nice study that showed that you can get effective, antibody response by using half-dose vaccines. So you're cutting down on the amount of, components of the vaccine that
we got a quote from this study.